My educational background is in biochemistry. I have both a master's and a PhD in biochemistry. And then I've worked with in the academia, both in Finland and in the US, and studying cancer, its development, invasion, angiogenesis, and different models, how to properly study that. And then I also have this title of docent or adjunct professorship in cancer biology. And in biobanking, I have been about 10 years for now, and a little over 10 years in the academia before that. Well, in short, biobank is a research supporting infrastructure that is collecting human samples and data, and then giving researchers access to those samples and data so they can make projects and hopefully develop better treatment, better diagnostic tools, and better health for all of us. The core of biobanking is the collection of these informed biobank consents. It means that we are in constant contact with in the hospital wards and clinics, and not only the Oulu University Hospital, but also the four central hospitals in the area. And we have to kind of educate and motivate all the nurses and doctors and clinical administrators so that they know how to answer if a patient has additional questions on biobanking. So they have to be aware of what's going on and all the possible changes that's happening for us. And in addition to the hospital staff, also the general public is someone we need to inform very actively so that people know what's biobanking and why we do it, and so they can consider that if they would be interested in participating. So after the consent, the next step is collecting samples. The samples can be tissue samples, they can be blood samples, urine samples, DNA samples. And in the sample collection, we have to organize the processes, how to collect it, the logistics, and also quality issues and how to store it, and if we are doing some analysis or processing of the samples. So all these aspects need to be managed properly and with high quality, of course. And then, of course, we want to researchers to use our samples in their projects as much as possible. So the next step is the access requests coming from researchers. We have a scientific committee that meets around once a month, and they evaluate all the access requests. And if there is a positive decision on that requests, and then we do material transfer agreements and all this kind of administrative paperwork, then we can gather the samples requested and also the data. And biobanks are coming more and more like a data banks, because only the sample without any clinical information is not worth much. So the more data you can link to the samples, the more valuable the samples are. The data can be diagnosis, medication, laboratory values, and so on. And all this is covered by different laws and regulations. So legal aspects are also very important part of our work. To make a successful biobank, it's really mandatory to have interprofessional work and interprofessional network. And even within the biobank, we come from very different background. There are biochemists, biologists, geneticists, statisticians, engineers, lab technician, and administrative people. So the more variety there is in our group, the better. And that's a big part of the communication is in the biobanking to making it successful. It's much easier for if there is a nurse in the biobanking staff and she would go and discuss the nurses in the outpatient clinics and in the wards, so they kind of understand each other and know where they're coming from. So the interdisciplinary backgrounds are very important in biobanking to making it successful. Well, of course, every country has their own laws and guidelines and authorities, but there is, on the European level, working together to kind of make the processes more smooth and more similar. There is this organization called BBMRI ERIC, which is like the European umbrella organization for different countries that have this own node, and they are collaborating quite actively and organizing yearly meetings, for example, for the biobanking community. And of course, on the EU level, we have the GDPR, data protection regulation that affects all of us. The amount of breast cancer samples in our biobank, well, of course, it depends on the sample type, but for the paraffin-embedded tissue samples, there is about 22,000 samples now available. And then we also have a large number of, or increasing number of blood samples, which is around 1,000 samples for breast cancer. And then you can get serum or plasma and DNA and also genome data from these samples. And of course, there are hospital biobanks within Finland, so we're not the only one. So if you request samples from all these biobanks, so that sample amount will be much higher. The projects or the access requests that we get, there is about 20 to 30 per year. It varies a little bit. The largest amount of requests are coming from cancer research. Of course, not all of them in breast cancer, other cancers as well. And also the Finnish maternity cohort is very, very actively used by the researchers. And with that, you can also do cancer research, kind of this pre-diagnostic sample, and see if there is something that is leading towards a cancer diagnosis in later in life, and if there are some protective agents in the serum samples. So that's a very interesting concept. But apart from those two big groups, also the rare diseases are very popular projects, and also immunological diseases and some epidemiological projects as well. Well, in the near future, we are very much looking forward to getting this electronic consenting for the patients. So we have been working with paper so far. So this is something very good that is happening in the near future. And the data lake, hospital data lake development is also something big that we are eagerly waiting for. The collaboration with Finnish biobanks has already been very good and very fruitful. We have this cooperative called FinBB, which offers a one-stop shop kind of access portal to all Finnish biobanks. So the research don't have to apply separately for all biobanks. So they can have one access point. And there is the FinBB also has big plans for kind of this sample catalogs in the future. That we have a sample catalog for blood samples, but it would be covering more sample types in the future. If we think about the approach that every patient has a right to be a research patient, so biobanks are essential in that because we work in every hospital, every ward, every clinic compared to the traditional way of doing biomedical research is that the research group has a very specific research question or a certain specific disease and make a very specific consent only covering that certain specific issue. But the biobanking concept is broader, that we can collect samples that their use is not yet known. The methods are developing, and that's kind of the building a reserve for future researchers. And we should remember that only with research there comes better treatments, better diagnostic, and in the end, better health for everyone.